thrilled to be here with Dr. Acharya from Ohio State University. And we're here to chat a little bit about our upcoming Head for the Cure 5K in Columbus. And let me first introduce myself. I'm Matt Anthony, the founder and president of Head for the Cure. And it's such a pleasure to be here today with Dr. Acharya, who's leading some very important research in the Ohio State community to help brain tumor patients in the Ohio area. So, Dr. Acharya, great to meet you. Tell us a little bit about your practice and kind of what brings you to Ohio State.
Hi, Matt. Thank you for inviting me today. It's really wonderful to be with you here today. I'm an assistant professor here in Ohio State University in the Department of Neurology and the Peltonia Institute of Immuno-Oncology. And my lab focuses on deciphering neuroimmune circuits and neuroimmune communications. And my focus is on brain tumor.
We're thrilled over the years to have partnered with you and your colleagues at OSU. I'm curious, you know, the funds we raise, how important is it to your research for funds that come from kind of a grassroots organization like Head for the Cure and events like our 5K? How meaningful is that?
You know, like currently there are very limited options for glioblastoma, and the main treatments usually include just surgery and radiotherapy and chemotherapy, but the outcomes are often very poor. And as you may know, despite maximal surgical resection and chemoradiation, glioblastoma continues to be associated with significant morbidity and mortality. So novel therapeutic strategies are urgently needed. And the last FDA-approved medication, you know, which improved overall survival, was more than a decade ago. And since then, despite multiple trials, we've not managed to move the bar. So the fund raised through the events like you are organizing, it will help support new innovative research that will ultimately contribute to transforming the standard of care for glioblastoma.
So Dr. Acharya, I know that your focus is that you manage the lab to study tissue to ultimately help the clinician who is treating that patient and prescribing the right treatment path. What is that interaction like between you and the clinic who ultimately sees the patient? How do you sort of collaborate, lab to clinic and back to patient?
Well, that's an excellent question. Like my lab, I mentioned before, it's focused mostly on immune checkpoint therapy. And we've been trying to see if immune checkpoint therapy can bring about any benefit to glioblastoma patients. So the current focus right now is to identify biomarkers where we can subset patient groups who would be more responsive to immune checkpoint blockade therapy.
That's great. So are you finding, you know, promising, knowing that the ultimate outcome to cure disease that has been for many years incurable? What progress are you seeing, and what discoveries are you finding in your lab that provide hope for patients today, but perhaps even more importantly, you know, patients tomorrow in the years ahead?
So the brain tumor, it has a very unique microenvironment, and it's very highly immune suppressive. So what we are focusing in the lab is mostly to understand what contributes to this immense immune suppression. So we have some data in our lab which suggests that neurons, they contribute to this immune suppression by releasing certain neuropeptides. So we have been trying to understand the dialogue between the neurons and the immune cells and seeing if blocking this pathway would improve immune checkpoint blockade therapies and, you know, efficacy of these therapies in these patients.
As you communicate back from the lab that ultimately might find its way into the hearts and minds of a patient, what would you want those patients to know about brain tumors, about brain cancer that maybe would give them hope?
So, you know, brain tumors are always treatable, although many of them cannot be cured. And some patients do a lot better than expected with treatment. And ideally, treatment should be, you know, in a setting of clinical trials. And the best outcomes are usually achieved when there's a team of brain tumor specialists with high level of expertise, which delivers cares to patient in a multidisciplinary setting. So the key is for such specialists is to constantly communicate with each other about patient care, and also importantly, communicate with the patients and the caregivers about the goals of the treatment. And I think there is some hope for brain tumor patients as well.
And so collaboration is really important. So
Collaboration is really important. And I think, therapies like immune checkpoint blockade therapy, which I've been talking about a lot because, it's shown immense outcome in other different forms of cancer. Now, we just have to identify why brain tumors are resistant to these therapies. So work done in my lab and several other labs will hopefully be able to identify what causes resistance to this therapy.
we're thrilled the Ohio State and with you in particular to help your lab create new discoveries and make a difference.
Thank you so much, Matt. We are also very honored to be part of the event. And we would also like to invite everyone to join the 5th Annual Head for Cure event in Columbus, which is on May 21st. Thank you so much.
Thanks so much, Dr. Acharya.